Hi, welcome to this interesting video about drugs and liver damage. Liver injury that's caused by over-the-counter or prescribed drugs is a relatively common cause of liver damage. Fortunately, the great majority of patients with this type of liver damage will recover when the causative drug is stopped. However, occasional severe cases may develop which result in severe progressive liver damage. Sometimes the condition may progress to death, or a liver transplant may be required to prevent death from liver failure. Drug-induced liver injury, or DILI, or DILI for short, is a common cause of liver damage in the United States. Acetaminophen, commonly known as Tylenol, overdoses are not unusual, and the severity of liver damage with this type of overdose is proportional to the amount of acetaminophen consumed in the overdose. Other than for acetaminophen, DILI is usually not dependent on the dose of drug consumed, meaning it usually results from taking a normal prescription-sized dose of the drug rather than an overdose. Also, DILI is usually idiosyncratic. This means that its occurrence is unpredictable, often occurring from a drug that doesn't cause DILI in the majority of people who take the drug. Idiosyncratic drug reactions, often including DILI, are often difficult or impossible to predict or anticipate ahead of time when the drug is prescribed, because it's usually unknown what will cause one person to react badly and another person to have no problems at all from the drug. Which class of prescription drugs are the leading cause of DILI? Antibiotics. Antibiotics result in around 45% of cases of DILI that's caused by prescription drugs. Most patients are initially identified because they become jaundiced, meaning that their skin and eyeballs develop a yellow color. Most people with DILI make a good recovery after the causative drug is stopped. However, up to around 17% of people who develop DILI may be stuck with chronic liver injury, with a smaller percentage dying or requiring liver transplant surgery. It's important to emphasize that the vast majority of people who take over-the-counter or prescription drugs will not develop DILI. However, because DILI can occur in relatively rare instances, it's important to be aware of this condition. Let's talk about the symptoms of DILI. The symptoms of DILI can mimic many other diseases, making it challenging to diagnose. However, some common signs and symptoms of DILI and liver disease in general include all of the following. 1. Jaundice. This is yellowing of the skin and the whites of the eyes. 2. Urine that turns dark brown or amber in color due to the excess bilirubin chemical that is not being properly processed by the damaged liver. 3. If the liver is not producing enough bile, the stool may become very pale or even clay-colored. 4. Nausea and vomiting. 5. Pain or discomfort in the upper right area of the abdomen can indicate liver injury. 6. Fatigue and weakness. 7. Loss of appetite. 8. Unexpected itching can be a symptom of liver disease, often due to the buildup of bile products in the skin. 9. Swelling due to fluid in the legs and abdomen. And 10. Changes in mental status. What can this mean for you? If you develop unexpected side effects from over-the-counter or prescription drugs, or for that matter, even herbal supplements or illicit drugs, you should very promptly seek qualified medical evaluation and care. With particular regard to DILI, be aware of signs of liver damage that we just discussed. Emergent recognition of DILI and immediate discontinuation of any causative drugs may prevent severe or irreversible liver damage and may even be life-saving or prevent the need for potential liver transplantation in relatively rare but severe cases. I want to emphasize that in the vast majority of cases, over-the-counter drugs or prescription drugs do not cause DILI. However, DILI can occur in some instances. So being aware of signs or symptoms of DILI may alert you and your qualified healthcare providers to the presence of this potentially dangerous condition. Don't stop taking necessary prescription medications without the advice of a qualified medical professional. However, if you believe you may have developed DILI or signs of liver damage from the drug, always emergently contact a qualified medical provider to discuss and further evaluate for possible presence of DILI. I want to thank you for watching this video and joining me in shedding light on this important issue. If you found this information valuable, please subscribe to my channel for more informative content. As always, check with your own healthcare provider to determine tests and treatments, if any, that are appropriate for your specific circumstances. Thanks very much for watching and listening, and until the next video, stay healthy.